infection is an infection from microbiomes. These are organisms that are so tiny you can't even see them unless you use a microscope. Most UTIs, which is a urinary tract infection, is caused by bacteria, although you do have a few that can be caused by fungus, very rare viruses. Hello again. Welcome back to another episode of the Health Exchange Chat Room on Living at Your Finest with Dr. Babs YouTube channel. If you're meeting me for the first time, nice to meet you. I'm a board certified family physician. I'm the founder of Living at Your Finest company. I'm a health and a fitness coach, and I'm a woman that is truly honored and thrilled that you are here. Thank you so much for checking out these videos. My passion is to apply a fun, fundamental, faith-based framework to help women to live at their finest holistic health so that we are empowered to possess our worth, to nourish our spirits and our bodies, and triumph as health champions. Your support is greatly appreciated and is needed for us to grow together as a community of health champions. So please, if I could ask for you to do me three big favors. They all start with S, so it's very easy to remember. I would like for you to leave a statement, to subscribe if you haven't done so already, and to share with friends and neighbors. Thanks in advance for doing so. So as you already know, our topic for today is urinary tract infection, also known as UTI. I will provide information that would enable us to be transformed and triumph as health champions. We will dive into the following aspects of a UTI. So we're going to talk about what a UTI is, what are those risk factors, what are the symptoms, how do we diagnose a UTI, and we're going to end up talking about preventative measures, treatment, and how we can debulk the mist. But first, let us go into our exchange chat room. I am so thrilled that I have a sister with us. She is going to tell us all she knows about a urinary tract infection, also known as UTI. Her name is Tolulope Alade, and she's an agricultural economist. So I really, really value her time. She's very busy. So let's welcome her. Welcome, Tolu, to the Health Exchange Chat Room.
All right, good evening. It's a pleasure to have me and to be here.
Thank you. So let's jump right into it. What do you know about a UTI?
Okay, basically, I would say UTI is a urinary tract infection, and it's often called UTI. So it's a disease or an infection that is contracted maybe from using a dirty toilet or probably contracted from another sexual partner or by maintaining a low level of hygiene.
Awesome. I like the first and the second. The middle one is not absolutely correct, but I'm here to debunk that. So, what are some of the complaints that people have? Are you familiar with it?
Okay, I think I know of frequent urination,
Okay.
then inflammation of the genital organ, then
Yeah.
pain in the genital organ, and some parts that are infected.
Very good. Very good. I like how you say the genital organ. So, for an economist, I'm very, very impressed with your level of health awareness. So, thank you for that. So, definitely pain while passing urine, going all the time. And I'll talk about so many others when I go into the discussion room. Now, last question I have for you. How can we prevent a UTI? Because it's very uncomfortable. I've had a fair share of mine, and it was not funny. And when I had it, it was many, many years ago. I'm so convinced it was because I sat on a toilet seat. And from then, anytime I go to the bathroom in public, I never sit down. So what ways can we prevent this? Do you know?
Okay, I would say from experience, I would say just maintain a high level of hygiene. Watch the toilets that you use. Don't just go anywhere and use the restroom anyhow. Just be careful. Then, um, well, I would say you our underwears should be kept clean always.
Yes. Yes, absolutely. Because most of the UTIs are caused by bacteria, and any opportunity it gets to sip into the urinary tract, It can cause an infection. Well, I really appreciate your time, Tolu. Do you have any questions that you would like for me to debug when I go into the discussion room?
Okay, I'd like to know the most effective prevention
Okay.
method. I'd like to know how hazardous is it if it keeps occurring, if somebody keeps experiencing it. Then I'd like to know, okay, what are the don'ts and the do's so as not to contract it?
Absolutely. And that is a very, very common question. I get that a lot from my patients. So thank you. I will make sure that I debug that in the discussion room. I really appreciate your time again. Thanks for spending time with us.
Well,
Enjoy the rest of your day.
thank you.
UTI can happen anywhere in the urinary tract. Your urinary tract is made up of the kidneys, the urethra, the bladder, and the urethra. Most UTIs can involve the urethra and the bladder. So we all know where our bladder is. And so the urethra is just the passage between where the urine comes out and the bladder. And then the urethra is between the bladder all the way to the kidneys. So most UTIs involve the ureter and the kidneys in the upper tract, and then in the lower tract, it's more of the urethra. I know the words all seem mixed up. Although the upper UTIs seem to be rare than the lower UTIs, which is more of the bladder and then the channel that the urine passes before it comes to the outside. Now, what are some of those symptoms? I'm sure you want to, you already know some of them, right? Going to the bathroom a lot, as you heard from my guest in the exchange chat room, wanting to go to the bathroom, sometimes pain. So there's burning on urination. You're like, what's going on here? Oh my gosh, it's burning. Stop the burn. Or just I just peed. Why am I going back to the bathroom? Some people can have abdominal pain. Some people can even have blood in the urine. That's the scary part. It could just be cloudy. It could just be cloudy. I've had patients say, "Why is my urine so yellow?" So those it looks like a cola or tea. Sometimes it could have just a bad odor. You're like, this is not normal. And for men, it could be just rectal pain because of the reason behind having the urinary tract infection. Now, if it is upper, so more towards the kidneys and the urethra, right, then it can even lead to sepsis. They can have fever. They can be, just weak altogether because they have sepsis. The infection has gone into the bloodstream. So those are some of the symptoms. Now, there could also be nausea, vomiting. So all those symptoms of just overall sepsis. Imagine infection in the bloodstream. Why does this happen, right? I'm sure you want to know. We talked about some of them in the exchange chat room. So let's look at it this way. Anytime bacteria is in that pathway, it's not supposed to be there. It's causes an obstruction. So it's like a sewage, right? If you have a sewage that is stagnant, it's not flowing, then all sorts of things begin to multiply and happen and cause a lot of havoc. And so that's the same thing for a urinary tract infection. So anything that increases that potential infection can lead to UTI. So things like, you know, older patients tend to have, they're more prone. Pregnant patient also is prone. If you have any chronic disease like diabetes, or a weakened immune system, your body is not able to stop any visitation of a bacteria where it becomes superimposed and becomes more aggravated. So things like that. Or maybe people that just lie in bed and not moving around. Or what's about catheters? If you had catheters maybe just right after pregnancy, or you had a surgery and it's not changed or removed, then yes, it's like it's like a sewage waiting to be clogged anytime soon. If you've had a previous history of UTIs, always having a UTI, as we alluded to in the exchange chat room, those are some examples. Now, there are other examples. It's interesting that for women, because we have a shorter urethra, right? It takes the short distance from the bladder to where the urine comes out is so short. So you can imagine that bacteria can easily come and go in through that passage. So, for women, that tends to happen. For men, a risk factor is if they have an enlarged prostate. And, the prostate, the channel where the urine passes, right, is right there. So if it's constricted, then you're not letting the urine pass out the way it needs to. So for men, the reason why you would see a urinary tract infection, which is uncommon, is for that same reason, because they have an enlarged prostate. Now, sexual intercourse. Remember, my guest talked about sexual intercourse. Now, it's not a sexually transmitted disease, UTI, it's not. What tends to happen with sexual intercourse is that, bacteria can, because of the pressure on the female urinary tract during intercourse, it can move bacteria from the anus, right, into the bladder and causing problems. So, and again, naturally, if you don't have any chronic disease, you're well hydrated, that bacteria flushes out within 24 hours. If it doesn't flush out, though, that is where a urinary tract infection tends to happen. Some men, this spermicides, so the sperm can increase UTI and cause irritation in some women. It varies from people to people. So that's why we're really encouraged to empty our bladder. Go and do a nice clean after sexual intercourse, because it helps to get rid of any bacteria that might have found its way into the urinary tract. Condoms used during sex has also been shown, that especially the non-lubricated latex condoms can cause friction and irritate the skin a whole lot further. So these are important things. There's some contraceptions like diaphragm that also puts pressure on the women's urethra to lead to decreased bladder emptying. Now, some people don't use, they go to places and they don't want to use the bathroom. Like what happened to me when I was in college. I had a urinary tract infection and it was horrible. I used the bathroom and I sat on it, I believe. I don't know, remember if I cleaned it properly. And I'm so certain, even though studies now are showing that it's not really hygiene as such. But from my experience, I know that I had a urinary tract infection right after using the bathroom. So you definitely want to make sure that you have good hygiene. For women, as we get older into our menopause years, because of the decreased estrogen, it tends to cause a change in the bacterial balance in the vagina. So these can increase the risk. So how do we diagnose a UTI? I'm sure most of you already know it's a urine test. It's clinical, of course, the way your symptoms present. But how do we confirm? We confirm with a urine test where we check and see how many white blood cells you have, and then we do a culture to see if we can isolate the bacteria, and we know what antibiotics will be best suitable for the bacteria. Now, the most common bacteria is E. coli, and that is something that you've probably heard your provider say if you've ever been treated with a urinary tract infection. Now, we want to know, how can we prevent this, right? Sometimes you might have, and let me just backtrack. There, other than a urine test, depending on how severe you look in terms of your symptoms, if it's urosepsis, meaning that it's the upper urinary tract infection with the kidneys, then you would probably get a CBC checking to see if you're anemic, if you're feverish, what's going on with your white blood count. Then you can have other tests done. But for a basic lower UTI, which is just the bladder and the urethra, then it's just a urine test. How do we prevent this? My wonderful guest wanted to know, how do we prevent this? I want to know how to prevent this. A lot of my patients want to know how to prevent this. Drinking water. Water. It drains out our body. It removes all the toxins out of our body. So we gotta drink water. Don't hold your urine. When I was in college, or when, because of my experience, and it was such a terrible experience, I never wanted to have a UTI again. I would hold my urine, I wouldn't go, or sometimes at work, I'm so busy seeing patients that I don't go to use my bladder. That is not good, because you're going to have urine sitting down there. And if for any reason there's already bacteria, it's going to multiply. It's going to be having a dance. And then a dance will turn into a stay party, and then all sorts of, things happening. So definitely want to not hold your urine for long periods. You want to talk to your provider, your healthcare provider, if you're having problems with urinary incontinence where you're needing to use a diaper, and that's for older people, or you're having difficulty emptying your bladder for the men. If you have a constricted prostate, you want to talk to your doctor, because you want to take care of the root cause right, to be able to prevent it. Now, for women, of course, as I said, as we get older, estrogen begins to reduce. We know that, right? So, how can we help this situation? We can use topical or vaginal estrogen, and that will help to lubricate us so that we're not having a severe change in our vagina flora. All right, so you want to talk to your provider about that. Now, some women, if they're finding that even after they clean themselves after sexual intercourse, they're still having a UTI repeatedly, then they need to talk to their doctor, because some of them could qualify for prophylaxis antibiotics rather. So prophylaxis antibodies could be very helpful for these people. But again, be aware that if you're taking antibiotics long term, you have to make sure that you're treating your microbiome, because you're making a shift in your GI tract. All right, so those are some of the preventative measures. Cranberry, have you heard about cranberry supplements? Some people say cranberry juice. And the reason is because even though science is a little bit iffy about it, they say that the cranberry actually has a chemical in the cranberries that help to prevent certain types of bacteria that causes a UTI, and it prevents it from attaching to the lining of the bladder. So I know patients that it has worked for. Just be careful not to take the one that has high sugar content, because you don't want to take care of one problem and create another problem. All right. They also have some of these vagina probiotics. In one of my videos, I talked about the benefits of pro and prebiotics for the GI tract. So the same thing applies for the vagina. We are mostly made of bacteria. So we want to make sure that if you're having frequent UTIs, you can take some of those, like lactobacillus. It's one of those probiotics, but you want to talk to your primary care provider or your healthcare provider so that they can walk with you on the best choice. Okay. Now, we've talked about prevention. I think I've covered most of the preventative measures. Definitely maintain good, clean hygiene. It's funny because I read that, we always talk about women cleaning from front to back, and they said they didn't really see a correlation between that poor hygiene and increased UTI. I'm sure most of my women will disagree. They will continue to clean from front to back. I think it makes sense to do that because you don't want to introduce any bacteria from the anus into the vagina area and hence into the bladder tract. Now, how is it treated? Treatment is all about antibiotics. Antibiotics, of course, lots of fluid. Hopefully you don't have the upper where you have sepsis, because then that would need an IV antibiotic. If it's just the lower part of the abdomen, then it's just the PO. Now, a PO meaning oral antibiotics, and it would be the best suitable one depending on what your culture grows. Okay, now, how long you take it, again, it's one-on-one conversation with your doctor. In my practice, if you don't have any chronic diseases, it's really between 3 and 5 days. If you have chronic diseases like diabetes, autoimmune disease, then I extend it between 7 to 10 days. And this is all evidence-based medicine. All right, so those are the basic information. Again, that's for bacteria. If it's, as I mentioned, it's really caused by viruses or fungus, but, they're antiviral as well as antifungus treatment. So that's all that we need to know. Be aware that don't take antibiotics from your sister's cabinet or your mom's cabinet. It might not work. It's not any and every antibiotics that's going to work for a UTI. So you have to be cautious. You have to be careful. Make sure that it's diagnosed, it's confirmed, and it's treated appropriately. Now, what about people that are just having it over and over? I mean, that is a headache. I have a patient that in a year, we'll probably treat it like 6-7 times. Now, that is not good. We need to search for the reason for this reoccurrence. So we have to look for obstructions, any abnormalities that is causing a constriction to the urethra. That's the tube through which the urine passes. So an ultrasound can be done to see if there's any blockage. You have what we call an IVP, which is an intravenous pyelogram, that would also check to see if there's any blockage in the urinary tract. All right, a cystoscopy, that's just a camera that looks into the bladder to see, hey, what's going on with the bladder? Why am I having a UTI all the time? It could be a mass, There's several things. It could be, you could also get a CT scan to give a more detailed image of the urinary tract. So several things to be done if there's a recurrent UTI. Again, as I alluded to initially, that if it's due to sexual intercourse or maybe your partner's sperm, then that discussion of whether you need to be on prophylaxis antibiotics, that is a treatment option, but it's one that you want to take with your primary care provider. So thank you so much for hanging out with me. I've enjoyed this time with you. I hope that you have been empowered, you have been entertained. I'm working on my entertainment skills. I hope you've been educated and you've been enlightened by the deep dive into UTI. So faith without works is dead. So I want to put a call to action. What are you going to do today? Are you going to increase your water to reduce that, sensation of something going on down in your urinary tract? I know I need to increase my water intake and to be consistent at it. So what are you going to do? I would love to hear from you. All right. Please do not forget my kind request that I made at the beginning for the 3S. I would love to hear from you. So please leave a statement, subscribe if you haven't done so already, and share within your circle of influence. You know that we're healthier together when we learn from each other. Thanks for taking the time to do so. So until next time, when we hang out together, remember that you can triumph as a health champion because you need to, you deserve to, and you most certainly can achieve to live at your finest holistic health. Wishing you the finest week. Be blessed and much love.